Hello. Congratulations, you've purchased a comprehensive saliva test with Cortisol Awakening Response. This is the large test that is for figuring out what's going on with your sex hormones and also figuring out what's going on with your energy levels, whether it be anxiety or fatigue. So we're going to go over for the next few minutes how to fill this test kit. Now, if you are female, you're going to want to fill this test out. If you're cycling, you're going to want to fill it out in certain days of the month that your doctor is going to have talked to you about to get the accurate read. If you're postmenopausal, then you're going to do it any day of the month, or if you're male, you'll do it any day of the month as the hormones are more stable. So that's kind of an important starting point right there. The inside of this box, I've opened it. It's got a FedEx shipping bag and a shipping label already done, already prepaid. You'll take this anywhere that they do take FedEx, give it to a real live person, don't drop it off in a box. Get a receipt for tracking if possible. If not, that's okay. But nonetheless, these two are taken care of for you for shipping. The other items in the box here are paperwork. Here, this is going to be highlighted for the areas that you have to worry about filling out. The areas that are not highlighted, don't worry about filling them out. So there is that information, and this is these are the instructions that you will be following when filling this saliva test. Inside of this box is a cooler, and inside of here is the package of vials that are color-coded so that you know when to do what saliva test or what saliva sample. So we've got 6 different vials in here. That's what's different about the other testing. There are more vials. And so the first 3 are the most important, as the timing of the first 3 tests is at the time you wake up, immediately upon waking, at 30 minutes after being awake, and then finally at 60 minutes of being awake. And you'll want to set a timer for those 30 and 60 minute marks so you get those right at that time. That's a very important awakening response pattern that we need to be able to get. On here, your name, date of birth, date you did this test, you'll write, and the different times that you do fill these saliva samples, you'll write down on here. So as you fill a saliva sample, some of the things that are very important. The first 3 colors are the yellow, pink, and the purple. So you'll do the yellow, keep that by your bedside. Fill that before you get out of bed for any reason at all. Then you'll keep your day light with restricted activity. Light, getting dressed or just taking a shower. That's all you'll do for that first 30 minutes. And then also before the 60-minute mark, you're going to keep things light. And then after that, you can resume normal activity. No caffeine that day, no strenuous exercise that day. So, and no supplements that day. So in here also are little straws. They're little clear straws. You use them once, throw it away, but you can use it to help you get the saliva in here. Instructions, the instruction booklet here is basically preparation. The day before, the 2 days before, if you're doing melatonin, what foods to avoid, but usually we don't test that. But the night before, it has instructions for that on how to prepare. Some key points in here are don't eat or drink anything an hour prior to the saliva collection, unless it's water. And if it is water, you have your water and then wait 10 minutes before you collect. It says here, don't brush or floss your teeth 30 minutes prior. We don't want any blood in the saliva. Don't have food or drinks that have caffeine. We touched on that. And so you've done the 3 that are first thing in the morning. And then you'll have a lunchtime before lunch, before dinner, before bed. And so you'll have gone about your day. So you will, before those last 3, you will want to wash your hands because maybe you were gardening and you've got dirt on your hands. Well, we don't need that in the saliva. It'll compromise it. So you'll wash your hands and rinse your mouth out with water because you will have eaten breakfast. And before lunch, you'll need to rinse your mouth out with water just to get any food particles out, but wait 10 minutes before you collect that. So that's on here. No cosmetics, or actually cosmetics are fine, but just no anti-aging creams. So that completes this section here. This section here is the who you are, like if you're male, female, when to do it, the time of the month. That's the information right there we've talked on already. Right here is redundant for this, which is the same color coordinated timing of the when to do the different samples. And there's a little bit more information here, a little more tricks. In here, things that are different on this page, it says the tube should be all filled and 3/4 full. So bubbles or foam do count. So that is very important on this page. And then after you fill the saliva, you freeze it. So as you go and you fill the saliva samples, you're going to, like the yellow one is the first one, you're going to fill it. You're going to fill it 3/4 full, bubbles or foam are okay. You're going to close it, and you're going to drop it in here in the freezer and keep this in the freezer with that loose yellow vial. Then you'll do the next one. You'll drop it in here. It will freeze. It'll be loose. It'll be with its partner, the little yellow vial. And the purple one, you're going to put that in here. As the day goes on, you're going to just put these in here free. You're going to keep this out of the freezer because condensation and writing don't go together. So this will stay out of the freezer until the last one is done that night. And then you'll write the time of that last sample. You put the sample in here and gather all of these out of the container and put them in here and put this in the freezer overnight. And you'll send it out the next day or the next business day. And it will need to be frozen. So that is the overview of this particular test. And of course, if you have any questions, you can call the office or watch this video again, as most of the details should be in here.